Coronaviruses are a group of viruses that can cause disease in both animals and humans. The severe acute respiratory syndrome or SARS virus, strain known as SARS-CoV, is an example of a coronavirus. SARS spread rapidly in 2002 to 2003. The new strain of coronavirus is called severe acute respiratory syndrome coronavirus 2. Coronaviruses are a family of viruses that can cause respiratory illness in humans. They are called corona because of crown-like spikes on the surface of the virus. Severe acute respiratory syndrome, Middle East respiratory syndrome, and the common cold are examples of coronaviruses that can cause illness in humans. Coronaviruses are common in certain species of animals, such as cattle and camels, although the transmission of coronaviruses from animals to humans is rare. This new strain likely came from bats, though one study suggests pangolins may be the origin. SARS-CoV-2 spreads from person to person through close communities. When people with COVID-19 breathe out or cough, they expel tiny droplets that contain the virus. These droplets can enter the mouth or nose of someone without the virus, causing an infection to occur. The most common way that this illness is spread is through close contact with someone who has the infection. The disease is most contagious when a person's symptoms are at their peak. A new study suggests that 10% of infections are from people exhibiting no symptoms. So it is more dangerous than other viruses. Most cases of COVID-19 are not serious. However, it can cause symptoms that become severe, leading to death in some cases. Common symptoms of COVID-19 include fever, breathlessness, cough, sore throat, headache, muscle pain, chills, no loss of taste or smell, congestion, vomiting, and diarrhea. These symptoms are likely to occur 2 to 14 days after exposure to the virus. Some factors can affect the risk of coming into contact with the virus, while other factors can affect the risk developing severe illness. The risk is higher for anyone in close contact with people who have COVID-19, such as healthcare workers. Viruses can also spread more in certain areas, such as highly populated cities. Older adults are most at risk of severe illness, as are people with the following chronic health conditions. Prevention of COVID-19. Finding effective ways to prevent the spread of SARS-CoV-2 remains a global challenge. Many viruses are preventable through antiviral vaccinations. However, it takes time to develop and distribute safe and effective vaccines. A vaccine for COVID-19 is unlikely to be available anytime soon. So the best way to prevent the virus from spreading is by avoiding close contact with people with COVID-19 and washing hands regularly. When soap is not available, use a hand sanitizer with at least 60% alcohol. Avoid touching the face before washing the hands. People with COVID-19 should stay at home and avoid contact with other people to prevent the illness from spreading. Keep surrounding surfaces as clean as possible and avoid sharing household items. Always cover the mouth and nose when coughing or sneezing. Face masks are generally necessary for people who have the illness. Anyone who has regular contact with people with COVID-19 should also wear a face mask. And that's all. Thank you.